Good evening, everybody. Hope you're doing well. This is Jeff Cook, Vice President of Beneficial Benefits and also Director of Sales and Marketing and of U.S. Operations. In this segment, this is number 3 for this week as we get very close to launch. The website is completed. Now it's going through compliance. A very good chance that we'll be launching as early as this weekend. I'd like to talk a little bit today about the pillars of what makes up beneficial benefits. 2 days ago, you heard about a transparent prescription card that has absolutely revolutionized the entire pharmacy market. I call it a pharmacy market buster, but it's really called a pharmacy benefits marketing. Pharmacy benefits marketing. So the actual term is PBM, but I like to call it a PMB, because it's a true pharmacy market buster. And it's a way to be able to save money. So that was item number 1. Beneficial Benefits is here to save their customers money with the top-notch customer service. Through our line of brokers that represent us, we want you to be able to trust to be able to call us, to be able to answer any questions that you have. We'll find out the answers for you and we'll get back with you. So trust is a very big part of Beneficial Benefits. Yesterday, we expanded that trust with Teladoc. And Teladoc revolutionized the telemedicine industry and is quite honestly number 1 when it comes to telemedicine. Now today is another pillar. It's the 3rd pillar of what makes up Beneficial Benefits. And this pillar is actually incredible because it will save you money over most insurance plans. And it's something that only 8% of Americans have. Dental benefits. Now I want you to think about this. In the Affordable Care Act, it mandates that you have to have health insurance. Now by the time you've looked at the sticker shock, whether it's an employer plan, whether it's an individual plan, whether it's a family plan, whatever the options were, when you went through open enrollment and looked at the different state exchanges that you had and everything, you notice it had dental plans there. How many of you actually looked at the dental plans? Well, you probably had that sticker shock because you saw the price way up here, but yet you saw the benefits way down here. In other words, the benefits were low scale at a high price. So how many of you actually looked at a dental plan? Probably not. All right? Well, the American Dental Association believes that only 8% of Americans have any kind of dental coverage whatsoever. Yet the American Medical Association will tell you that 77% of diseases that are brought into the body, including some cancers, come through the dental part, come through the mouth. Now, why would it make sense for us to have 8% coverage in the United States on dental on something that causes 77% of our diseases? Well, that's where Beneficial Benefits comes in. And with this program with dental benefits, you're going to be hearing about today how this is going to save you money for pennies a day. Literally pennies a day. It's part of all 3 packages. Just like our prescription card, just like the Teladoc that was yesterday's video, just like now dental by Aetna. Those are 3 pillars. Tomorrow will be a 4th pillar and it's called Medical Bill Saver. But today is dental. So let's get right into dental. Dental by Aetna is really a way to be able to save money. And I've compared it to Delta Dental of Kansas. Because being a husband of a state of Missouri employee, we have tremendous benefits, but we have Delta Dental of Kansas. I know what it costs to be able to have root canals done, what the cost of metal back crowns or just standard porcelain crowns. Metal back crowns are always the ones that are in the back because that's where you do all your chewing. I know what the cost is after the maximum yearly benefit, and in ours it happens to be $1,000. There are some plans out there that $1,500, $1,750, but you pay for that. And I've heard stories of people for families paying $173 a month for dental insurance. And even in that dental insurance, you're paying for $5,500 of orthodontic braces after maximum deductible. Now that's unbelievable. That's almost twice the price of what my oldest son had between 1997 and 2001 when he had his braces. We were on a monthly plan. It was $2,800. That was back then. It's double the price now. I'm going to show you a way of how you can save money now by using dental benefits. They're savings benefits. It's not insurance, but now it's good at 158,000 participating dental providers, all the way from your general practitioners all the way up to your oral surgeons. And there is a better than 4 out of 5 chance that your dental professional is on this list. So all I've done here is, talked about the benefits, but as I promised you, we're going to go into the screen sharing just like I did with Teladoc, just like what I did with the pharmaceutical plan, and explain how this is going to work. So if you will bear with me here right now, I'm going to go ahead and do some screen sharing. I'm going to go to my other desktop, and this is the dental program right here. This is the dental program. It is actually a savings event for absolutely everybody. Take a look at 158,000 available dental practice locations in the national network. This is your general practitioners all the way to oral surgeons. In every market, not just major markets, but every market. Members receive discounts of 15 to 50% visit on dental services. Okay, you're going to save that on services from crowns and cleanings to root canals. How about dental implants? Dental implants is something that insurance never covers. Yet in our dental access here by Delta Dental, in the dental access here by Aetna, we do implants. Why is that important? Well, if you have a tooth missing between another tooth, and it's basically you have a tooth on both sides. If it's the rear molar, it's one thing, but if it's in the middle, your teeth literally are going to migrate to that opening. So in other words, they're going to start tilting towards that opening. So the dentist is likely to say, all right, you're going to need what we call bridge work. And I know about bridge work because I have full bridge work in the front and full bridge work in the back because of an accident that I had on New Year's Day, 1979, where I hit the steering wheel in a 35-mile-per-hour crash after a major snowstorm and literally had 19 of my teeth knocked out because I broke the steering wheel in half. And why I'm still here today, God only knows. But what I'm saying is I know about implants. I know about bridge work. I know what needs to be done. So this covers implants. This is something that you don't usually see anywhere else. Now, as I bring this forward up here, there are the discounts. There are 158,000 dental providers. By the way, a year ago, that was 132,000. So they have added another 26,000 dental practitioners in the last year. Okay? It's not available to Vermont residents. We don't even have benefits in Vermont. Okay, Vermont and Washington are 2 states we don't have benefits in, and nobody does. Voluntary benefits are not allowed in those 2 states based on their state law, so that's okay. It is called the Aetna Dental Access, but with this, it comes with your program, whether it is the low program at $15.95 or the high program at $28.95. This is one of the pillars. Now let's understand some facts here. All right, this is going to cover your entire family for pennies a day. When you think about even the lowest price, $15.95, $16, there's less than 30 days or less than 31 days in an average month. Some have 31, some have 30. So call it 30.5. There's a 28 and a 29, depending on February. So when you stop and think about all of the benefits that you have, even in the $15.95 plan, all of those make up a certain portion of that $15.95. Then you divide that by the 30 or the 30.5, and you notice that these things are less than $1 a day. They're less than half $1 a day. They're less than a quarter a day. And this is dental. Wouldn't you like to have this kind of coverage for less than 25 cents a day? Wouldn't you? For your entire family. We're not talking just you. We're talking your entire family. Alrighty, so basically there's a toll-free number in your membership kit that you'll get that you'll be able to call any one of your providers. There's a website. Notice it says locate a provider. Click here. All you have to do is put in your particular zip code and it's going to find a provider for you. My provider is on there here in Kansas City. Okay, to receive the discount, you just present the card that's in your fulfillment kit that you will receive. Is there a limit to a number of times the card can be used? No. Members and their families may take advantage of the savings anytime throughout the year. Also, I want to explain what families mean, living under the same roof. If it doesn't make any difference if you have a newborn or a 110-year-old grandmother. If you're all living under the same roof, you are all covered. There are no differences between one person and 21 people. You're all covered under this plan. So the more members of the family you have, the less expensive this becomes. This is really no-brainer stuff. May this discount be combined with dental insurance? Yes, in some cases it can. If your insurance company allows you to submit claims after the service, you just visit a participating dental provider, pay the discounted bill, and submit the bill. Isn't that incredible? Well, in our case, Delta Dental, my particular dentist will allow me, and our oral surgeon will allow us to be able to do this and submit it to Delta Dental. So that is outstanding. Someone that can answer questions about the cards, that's us. We're going to be able to answer all of the questions that you want. Let's take a look at the sample savings right now. All right, where the break-even point between the dental access by Aetna and the insurance, and I'm going to use Delta Dental because it's probably the largest known one. Aetna's up there too. Break-even point's about $140. Okay, so here is average cost, and I want to show you what average cost comes from. May vary by provider. This was done as displayed at the cost of a care tool as of August 2014. So this is very, very recent. All right, so a periodic oral exam, the average cost is $61. With us, it's $32. You save $29. You can read everything that's here. I want you to take note of what I'm going to bring down here right now. A root canal, a premolar tooth, excluding the final restoration, okay? $582 as opposed to $906. Delta Dental of Kansas is $752 after the copay and deductible, okay? Root canal, molar excluding final restoration, $784. Delta Dental of Kansas, $962 after the deductible. And if it's maximum benefit, let's get into something really big. What about orthodontic treatment for a child? That happens to be braces, okay? Remember when I said it was about $2,800 back in the late 90s? Take a look at this, $3,550. Through Delta Dental of Kansas, it is $5,432 after the $1,000 maximum benefit. And you know what? Most insurance plans, if you have 2 or 3 children, they make you split that up into $500 chunks per child for a maximum of 2. Wouldn't it make sense to have this rather than have some kind of insurance and be able to go to 158,000 different providers? This is no-brainer stuff. This is why I call this the diamond in the rough. This is why at pennies a day, less than a quarter a day for your entire family. And again, the larger your family, the better the savings. This is why the dental portion is absolutely the hidden gem. And if you don't believe it, ask a doctor about what kind of illnesses you can get from your dental work. What kind of things happen if you don't go see your dentist properly? What if you have a cavity? Well, not only does it hurt, but did you also know that that means that you can get bacteria that goes inside the cavity that gets into your bloodstream and can go elsewhere in your body, because everything is attached to the bloodstream. When you extract a tooth, what happens? You bleed. So if something comes in from bacteria, doesn't it make sense that it goes through the bloodstream? Absolutely. So this is why dental care is so important, yet it is not part of the Affordable Care Act. And why it isn't, I'm not sure, but of course, obviously with the sticker shock that we have seen with the Affordable Care Act and what we're going to see later on this particular year with the Affordable Care Act, because of the 15-month demographics that they're going to look at to see who bought what, this fall is really going to be an eye-opener. Get ahead of the curve. We have dental access that will save you money. And again, I say the break-even point's about $140. Well, a typical crown is almost $1,000 in most cases. It's well under $1,000 with us. And a typical filling is almost $200 these days. You're going to save money on a filling by using this. You don't have to worry about, have I met my deductible? Have I used up my yearly maximum benefit? Nothing of that is any issue because of the card. It's a discount card. Ladies and gentlemen, this is a strong pillar of what Beneficial Benefits is all about. We're here to save you money. We're here to make life easier for you. You work hard for your money. Why not put it back into your pocket? Why not take care of your teeth as well as take care of your heart? Why not do the teledoc like we talked yesterday? Why not do the pharmacy and save yourself some incredible money on prescriptions, just like we talked about 2 days ago? Get with it. We're only talking plans that are under $16 up to under $29 a month. What's your insurance cost right now? Is it under $29 a month? No. Is it under $400 a month? Probably not. If it's just for you singularly, it might be, but what's your deductible? Way up here. Save it with this. Save it with telehealth, which is the teledoc program. Save it with the pharmacy benefits. Do it. This is the 3 pillars. The 4th one, and the one that's most exciting of all, comes tomorrow. Medical bill saver. And if you ever have to go into the hospital and have a major procedure done, or a broken leg, or whatever the case may be, this is going to be a lifesaver for you financially. I guarantee it. So from all of us here at Beneficial Benefits, on behalf of the brokers that represent Beneficial Benefits, on behalf of my partners that are part of Beneficial Benefits, that we have worked hard for the last 2 months to be able to bring you this program. My name is Jeff Cook, and I'm going to see you tomorrow when we talk about medical bill saver. Good night, everybody.